Hi, I'm Virginia Rasmussen, current board member at Manning Regional Healthcare Center and co-chair of the 2021 Capital Campaign. I've been on the hospital board for many years, and I'm proud to say that we offer a variety of quality healthcare services that are close to home. As a board member, we are committed to maintaining and enhancing the medical staff and services that need to serve our community. I invite you to take a moment to learn about the project underway at Manning Regional Healthcare Center.
We are launching a capital campaign called Project Forward, and we need your help to make this a reality. We have been very grateful for the existing facility that served us so well for the past 7 years. The services here have had to evolve over the years to meet the ever-changing needs of the demands of our patients. We are so proud to be able to offer a trusted family practice clinic, numerous specialty clinic providers who travel from Des Moines, Omaha, and even Sioux City, a respected substance abuse recovery unit, acute patient care services, and therapies for recovery. One of the recent additions to our hospital offerings has been the Senior Life Solutions program. Since its inception in 2017, this program has served 64 patients and numerous families to date. This program is extremely helpful to those ages 65 and older who struggle from the effects of depression and anxiety. We have moved their department all over the hospital to accommodate their growing needs, and then transitioned again when we needed space for the respiratory clinic and those patients were required to stay at home due to the pandemic. Our new capital campaign is going to transform an unused space into a space that can be utilized effectively by our Senior Life Solutions program, an enhanced pharmacy needs, and an additional negative pressure patient isolation room that will house 2 patients. This is an incredible moment for our region and for our community. This capital campaign is an investment in our current facility to continue to adapt and serve the needs of our patients. More importantly, it demonstrates our commitment to providing care close to home for those who are facing anxiety and depression, as well as a variety of infusions, including chemotherapy and other medications.
One unique fact that you may or may not be aware of is that the Manning Regional Healthcare Center is not a county hospital. Therefore, it's not funded by your taxes like many other rural hospitals are. While we are doing well financially, we need your financial support to ensure that we can involve and meet the increasing needs of our community.
Hi, I'm Randy Behrens, former board member of the Manning Regional Healthcare Center for many years. I am currently the co-chair or one of the co-chairs for the 2021 Capital Campaign, and I am committed to ensuring that we can continue to offer trusted healthcare right here close to home. I have been part of the transformation of the hospital from the location in downtown Manning to its location we're now at. I am proud to say that the hospital and the clinics continue to evolve and meet the needs of our patients. The capital campaign comes at a time when we have identified emerging needs in our communities, including addressing mental health issues, providing increased substance abuse treatment, and continuing to offer infusion therapy so that patients undergoing these life-saving treatments do not have to travel far from home to receive them. Here at Manning Regional Healthcare Center, we are proud to offer the healthcare services that our patients and communities need. Let's take a moment to hear from our trusted experts in these areas.
My name is Janet Bruce. I am the Program Director for Senior Life Solutions here at Manning Regional Healthcare Center. Our program serves patients that are 65 and older generally. And so since we've started, we have had over 65 families served, patients and families, and the need continues to grow. During the COVID pandemic, we had referrals from providers, family, even people themselves referred themselves to our program. And we've seen a 14% increase over the pandemic situation over the last year. And usually every month we serve about 345 sessions for our program, for our patients. Senior Life Solutions has been here since 2017. We are a growing organization here. Fortunately, the administration of the hospital had the foresight to know that this was such a need in our community. During the COVID pandemic, we had to suspend our group process just because of social distancing. And so as the hospital evolved with the respiratory clinic, they utilized that space for the respiratory clinic to keep our patients safe. So until then, we have been doing virtual groups, but we're excited to get back to a group setting. And so the expansion here at the hospital has been a part of that. And so we're so excited to be a part of this process to get that group room rolling. This space is dedicated to Senior Life Solutions. Up until now, we've kind of bounced around for different spaces to meet our needs as well as the hospital's needs. So we're so excited to have this dedicated space for our group room so our patients can remain safe while they come back to the hospital for services, as well as our staff to remain safe as well. We will also have a dedicated office spaces for privacy for our patients to come in and talk to the therapist. So in our new space, we'll have expanded AV audiovisual capabilities. So we'll have a screen on the wall so patients, in the event that they're not able to physically join us, can still join group and be a part of the group, along with the folks that are still able to come on site. So some of those instances maybe if they had a procedure and are not feeling well enough to come in but still want to participate in group, they can do that. Or inclement weather. Here in Iowa, we do have snowstorms, so as long as the therapist is able to get here, we are still able to conduct group. Hopefully, if this program has touched your heart or touched your family, we hope that you consider a donation to our program to keep our program funded and in this community for many years to come.
Hi, I'm Jen Morris. I'm the pharmacy director here at Manning Regional Healthcare Center. We in the pharmacy provide medications and pharmacy services to many different areas of the hospital, including acute care patients, skilled patients, surgery, and the infusion center. We are excited about this new project and the investment in healthcare in our community. I'm going to take you on a quick tour of our current locations and what we have in store for our changes. First, I want to introduce you to one of our staff people. Kayla Chapman is one of our certified pharmacy technicians, and she is the primary person to mix many of our infusions and chemotherapy. Here we are in the anteroom, and this is an area where we prep the staff to go in and do our compounding. So we have our PPE located to the side and our sink for washing up. And this area will be actually expanded into a 4-room model where currently we have 2 areas for compounding. This is our current compounding location. This is an area that has a hood with 2 different sides. So currently this side is mixing our hazardous medication, for example, chemotherapy, and this side is mixing our non-hazardous, like antibiotics or other infusions. Our new layout will have 4 rooms, as I said. One will be strictly dedicated to mixing our hazardous materials like chemotherapy, and the other room will be completely separate and will be mixing our infusions and antibiotics in that area. One of the unique additions to our new layout will be that we'll utilize pass-throughs, which are essentially windows inside the wall that will allow us to pass our products that are, for example, chemotherapy, when it's completed, out in a sterile way back out to our staff to administer it. One of our primary initiatives is staff safety. So with the new layout, we will have a room that's negative pressure that will be dedicated to the unpacking and the receiving of these hazardous materials. So the medications will arrive in a tote and we will bring them down to the negative pressure area where the staff will unpack them. This will be a great way to protect our staff. Another thing I love about this project is its emphasis on patient safety. We will be able to maintain our consistent mixing processes for medications with this change. This project means a lot to me because we're able to take care of our patients. We are able to continue to provide infusions and things like chemotherapy for our patients close to home. They won't have to travel to receive those life-saving medications. I'm so thankful for the foresight of our hospital administration by investing in this project. We will be able to be flexible and adapt to new medications as they come out, and we know that healthcare can change overnight, and so by being able to be flexible, this will help serve our patients.
Thank you for taking a moment to learn about the expansion plans for the Manning Regional Healthcare Center. We hope that you will consider contributing to our efforts to ensure that we can continue to evolve to meet the needs of our patients and communities. To donate, we will be offering several ways to make a contribution. You can visit our website, complete a donor form that can be found at MRHC, or we are sending out a variety of donation forms through the mail and local newspapers. Please help us with this campaign to ensure our healthcare services meet the needs of our patients today and beyond.
Manning Regional Healthcare Center, your trusted experts close to home.